if these numbers increase in the younger population, I think we're going to see increases in hospitalizations and ICU visits in these age groups.
Health officials are sounding the alarm over a troubling trend with the new variant cases of COVID. Provinces are already seeing a shift in hospitalization demographics.
We have seen several young people in their 30s and 40s who've unfortunately, tragically, been severely affected by COVID.
And BC isn't alone in the trend. In Ontario, those under 40 years of age account for more than half of all active cases. In Alberta, 2/3 of new cases over the last week have been those between the ages of 10 and 39.
And almost 90% of those in an ICU for COVID are under 65.
So although fatalities were most commonly linked to older Albertans or people with strong underlying conditions, we have a lot of people that are in these groups that have yet to be vaccinated in the intensive care unit.
The variants do not appear to specifically target young people, but they do have higher severe outcomes overall, while being 40 to 70% more transmissible, which may explain the rise in younger hospitalizations.
And the more people that are infected in the community, so rising numbers and more rapid spread, simply means more people will fall into that category, even if the percentage is still the same.
And while younger patients may be less likely to die, the outcome can still be dire.
The younger you are, the tougher the battle is, because you have this vigorous immune system fighting a vigorous virus. And that plays out a long game with a lot of morbidity.
Another factor, more than a year into the pandemic, many younger people believe they've sacrificed plenty for a disease that didn't hit them very hard during its first 12 months.
A lot of people who would like to be sort of more social and be getting out there and be frequenting, restaurants, pubs, whatever else, are the people who are now really at most risk as well.
The rise in younger COVID cases comes as older and at-risk Canadians begin receiving their vaccine. In Alberta, only 5% of active cases are in those more than 70 years of age. But when younger Canadians get the jab, just like older patients, it doesn't mean that group will immediately be out of the woods.
Even if you get the shot, it's another 2 to 3 weeks after that shot before you get optimal immunity.
Scott Frolick, City News, Edmonton.